Dear viewers, hello to all our English-speaking community on the island. I'm here to give you an update of the last news in COVID-19 country, let's call it that. As you might have heard already, there are new developments in that since yesterday we have 2 more new cases on the island. That brings the total to 37 in all tested positive in Curaçao, of which 32 of them have recovered, and we have 4 active cases. 1 person has passed away all the way in the beginning, and there are 2 cases that were still pending their results. There are 2 new cases since yesterday, as I mentioned. One of them is, as we have come to get used to the past months, I should say, that they were import cases only, and this again is an import case. It's somebody who was in the Netherlands and had contact with somebody who turned out to be positive afterwards and was in quarantine here, and now at the end of the quarantine tested positive. So that person is now in isolation, and so far so good, that can be contained. The other, however, is a little bit more problematic, is somebody who is a local living here on the island, of which we cannot trace back the source of the infection, and that poses a problem. Why does that pose a problem? Because if you cannot trace back where it actually came from, there is no connection with travel, there's no connection to somebody else who traveled, so you have no connection to what the source or possible source might be. And this means that in reality you have to take into account that there are probably more people have been infected, or others can still be infected by the same source, or possibly by other sources that have been developed in the meantime. So one untraceable source on the island poses already a threat and a problem for us, so that we need to take additional measures. Now, do we do that just by fly? And the answer is no. Of course, we have a program, we have a policy, and we're following an escalation model. What does that escalation model entail? There are different phases. The phase we were in up until now, we call it phase 0, and that's when we have cases, but all of them are related to travel. So the travel-related cases, that's only import, and there are no local transmission. Phase 1 is when there is local transmission, but we can trace it back to somebody coming from abroad. So the source is known and we can contain it. Phase 2 is when we have local transmission, but we don't know the source and we cannot trace it. That's where we are now, that's phase 2. Phase 3 is when there are clusters, and when there are more groups of people that have been infected and the local transmission has taken a flight. We call it code red, that's when it's phase 3. And each of these phases are connected to certain measures that we take. And the last phase is phase 4, and that's when our capacity for treatment in the hospital threatens to become overshadowed, and that we cannot handle that anymore. And before that happens, that'll be the point in time where we take the most drastic measures, which are, as you know, lockdown and try to limit contact as much as possible. We are not there yet. We hope also not to come there yet. As you may recall, we might have done that earlier last time around. Why did we do that? Why did we close off the country pretty quickly then? Because it was new. We didn't know how fast the virus could spread. We didn't know when we would reach an exponential growth of the virus within our community. And when you're not sure about that, but all your models that you do have point towards the direction that if the local transmission takes off exponentially, that the risk of surpassing your health capacity is enormous. And we couldn't allow that to happen, and that's why we had to take measures very quickly in the first phase. In the meantime, we have more experience with each other. We have done things together to keep the transmission low on our island. We'd like to keep it that way, but we have, of course, problems. Now, if we have a local transmission without being able to detect what the source is. So therefore, there are measures that need to be taken that are extra. What are these measures? First of all, concerning the person itself. So we need to isolate the person, and we need to do contact tracing. So we need to find out who are the people that were in close contact with the person, who were her co-workers, but also family, friends, members of her inner group that had close contacts, to find them, trace them as soon as possible, make sure they're in quarantine, and offer them tests. This is what we're doing with the workers and contact tracing. We've been doing that last night. We have them settled. They are in quarantine. We are following them through, and we are going to test also more liberal in the society as a whole. This all in an effort to try to find the source, or in any case, try to contain what is going on right now. These are things that we can do in terms of testing and in terms of trying to contain and finding the people, because as you might know, the strategy in trying to contain any disease is based on 3 very important pillars, and that is detecting, isolating, and contact tracing. And that's exactly what we're trying to do. Further to that, of course, we know from the experience, I just want to refer to Aruba, where they've experienced all of this already, where they found out that maybe in their case, the source was like in clubs, nightlife, lots of people, agglomerations. We call that, those kind of instances, we call those super spread events. Super spread because you only need 1 or 2 people who are highly infectious. That means they have a high grade of, high concentration of virus in the back of their throat. And if you're in closed, confined areas, you can very easily spread. If you shout or talk loudly or sing along, and that happens in small groups where there's hard music, where there's loud music, and you have to make yourself be understood, your chance of spreading the virus in a small contained area is, of course, very big. So these are the types of events that we want to try to prevent from happening. Therefore, the clubs are closed in that sense, but also all other events, even if they're outside, because if there's a lot of people there, we run into problems. And as I said, we don't know where the source is. It could be anywhere. And so you want to, in any case, try to prevent from these mass gatherings taking place. So all music kind of activities at night, be it in clubs or outside where there are a lot of activities, are a no-go. Also, public spontaneous events will also be curtailed, because we have to avoid people to coming together in big areas. If you have also sports events, let me talk about that first. Sports events are possible, but the amounts of people visiting, the amount of spectators will be limited as well. And in any case, all times making sure that there is enough possibility to maintain social distancing of 2 meters. Private parties could be possible, but with severely limited numbers, depending on the amount of space available, but never more than 50. So these are the limitations that are in place as of today. We need to do this. We know that it's difficult for many people, and especially for the entertainment industry, but these are worldwide the type of measures that you need to take if you still want to try to contain. I hope it's been clear. I hope I've been able to explain what's happening and why we're doing things. And thanks for watching until another time, and have a good weekend.